Hello everyone, I'm here to present the oral manifestation of HIV. Let's see one by one. Introduction. HIV is a retrovirus that attacks the body immune system, specifically targeting the CD4 plus T cells, which are the crucial for immune defense mechanism. Over the time, HIV can lead to acquired immunodeficiency syndrome, a condition where the immune system becomes severely compromised, making the body more susceptible to opportunistic infection.
Let's
and
see the
certain
mode of
cancer.
transmission. Blood transfusion, unprotected sex, organ transplant, sharing needles, and many sexual partners. Next, we're going to see about the EC clearinghouse classification. In group 1, lesions strongly associated with HIV infection. Let's see one by one. Candidiasis, oral hairy leukoplakia, non-Hodgkin's lymphoma, Kaposi sarcoma, periodontal disease like linear gingival erythema, necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis. In group 2 lesions, less commonly associated with HIV infection. Bacterial and viral. In bacterial, Mycobacterium avium, Mycobacterium tuberculosis, melanotic hyperpigmentation, necrotizing ulcerative stomatitis, salivary gland disease, thrombocytopenic purpura, ulceration, otherwise non-specified. In viral, HIV infection, HPV-induced warts, condyloma acuminatum, focal epithelial hyperplasia, varicose vulgaris, varicella zoster, virus infection. In group 3, lesions seen in HIV infections are bacterial infection, drug reaction, fungal, neurological, and recurrent after stomatitis. Let's see one by one. Oral candidiasis, pseudomembranous type. It is the commonest form, characterized by the creamy yellow curd-like plaques that can be easily removed with wiping with a cotton gauze or tongue depressor, often leaving a red or raw base. Erythematous form is also called as atrophic. It is characterized by the reddish macular lesion and loss of papillation when involving the tongue dorsum. Next, angular cheilitis. Angular cheilitis affects the labial commissure and results in cracking, ulceration, and pseudomembranous formation. Next, oral hairy leukoplakia. It is the second most common HIV-associated mucosal lesion caused by EBV virus. Oral hairy leukoplakia occur in patients with CD4 T cells counts less than 400. It commonly affects the men than women. Side, lateral borders of tongue and dorsum are more commonly affected. Bilaterally, as painless, faint white keratotic streaks or thickened or furrowed areas with shaggy keratotic surface are seen. Kaposi sarcoma. It is an angiogenic disorder in which the multicentric neoplastic proliferation of vascular spindle cell component occur in response to circulating growth factor. Oral lesion can occur on any mucosal surface, mainly on hard palate, maxillary gingiva, etc., and also seen in the tongue, uvula, tonsils, and pharynx. It is sometimes associated with cervical lymphadenopathy and salivary gland enlargement. Non-Hodgkin's lymphoma. It is the second most common neoplasm associated with AIDS. Lesions tend to present as a large, painful, ulcerated mass on palate and gingival tissue. Biopsy for definite diagnosis is necessary. Next, necrotizing ulcerative gingivitis. Involves primarily free gingiva, crest of gingiva, and interdental papilla, rarely seen on the soft palate and tonsils. It occurs at any age, most commonly seen in the middle age. Causes of necrotizing ulcerative gingivitis are stress, immunosuppression, malnutrition, trauma, smoking. It is a painful lesion, hyperemic gingiva, and sharply punched out crater-like erosions of interdental papilla. Patient complains of inability to eat, fetid odor, excessive salivation, and metallic taste. Necrotizing ulcerative periodontitis. It is characterized by the recession and increased attachment loss with shallow probing depths, bleeding, tissue sloughing, and loss of interdental papilla, fetid odor, and moderate pain are commonly seen. Herpes simplex virus. It is a chronic non-healing ulcer on the lips and intramural mucosa. Human papilloma virus are the warts or papillomas seen in the oral cavity. Finally, come to the treatment. Antiretroviral drug like zidovudin, lamivudin, antifungal drug like fluconazole, antiviral drug acyclovir or valacyclovir, antibiotic metronidazole, and steroids can be given. Thank you.